This morning we have a presentation from a remarkable lady. I'll tell you a little bit more about her in a moment, but she is in the business of clinical hypnotherapy. And when Chuck asked me to be the MC this morning, I kind of regretted selling my pocket watch and chain. And I thought I had all the tools, but there it is. So I researched this, clinical hypnotherapy. What is it? You know, is it that old trope that we see in all the old movies? You're getting very sleepy. And of course, it's nothing like that. And the more I read, the more I saw names like the Mayo Clinic, the Cleveland Clinic, the University of Minnesota. I mean, these are all serious institutions. So I thought, well, we better take this seriously. So I dug further and further into this. And I think the point here is that here at Moroff, we welcome all modalities, all forms of treatment, the new ones, the old ones, the ones that we're looking at again with fresh eyes. And I think that all phases of healthcare really need to be looked at as we seek more answers for totally intractable problems that we have in the healthcare system here. So what is clinical hypnotherapy? Well, I am much less qualified to talk about it than our speaker this morning, but I can tell you that it's an increasingly popular mainstream treatment and therapy in modern medicine. What does it do? Well, it can be used in pain control, addiction relapse, behavior change, mental health conditions of all types, and the side effects for cancer treatment. I've no doubt there are many other things that it can be used for too. It's my privilege this morning to introduce you to Rene Brent. Rene had 30 years as an RN, saw all phases of life and death in that capacity. And I'm not going to read her resume because she's going to be able to tell us far more about herself than I possibly can. What I can tell you is a couple of things about her that are important. She has 3 children. She was having difficulty getting pregnant for her 3rd child and kind of resisting that, and used hypnotherapy on herself. I'm sure she didn't administer it herself. I'm sure there was someone else who did that for her, to help her get into a state of mind where she could have that 3rd child. For her, transitioning to clinical hypnotherapy was a natural outgrowth of being an RN. As an RN, she was in the business of healing bodies. In hypnotherapy, she heals the mind that then allows the body to heal itself. So that transition was a natural one for her. She's also a best-selling author. And she's written something that's probably appropriate for swimsuit season, but it's called How Big Is Your Butt?
B-U-T.
Only one T. And I looked up the reviews on this last night, and I want to get a hold of a copy of this thing, and you will too. Here are some of the reviews. A must read. Life-changing and simple. Brilliant. Nothing else like it out there. Get this book and transform the way you think. Seriously. So the last one, Rene, thank you for taking the time to write this book to help myself and others move forward in life. And ladies and gentlemen, isn't that exactly what we all want? Isn't that part of why we're here this morning? So please help me welcome Rene Brent, our guest speaker this morning.
Thank you. Thank you so much for that. There you go. I have a voice that does carry, got me trouble school, so I'm glad I have a mic anyway. So welcome everyone. So clinical hypnotherapy, I'm sure that you saw what I'm talking about, clinical hypnotherapy. What is this? Who is this woman? Why is she here? And who's ever heard of clinical hypnotherapy? Just raise your hands. Yeah. So a lot of you have, and some of you I know and have worked with. A very quick description of what hypnotherapy is that we have wounds. Some can be physical and some can be emotional. And in the medical model of the world, we put a medicine on that. But we don't look at the wound. And when you don't look at the wound, the wound gets bigger and bigger, and then we put more medicine and more medicine and more medicine, and then we have these all emotions that are showing up because of chronic illness. If you deal with the wound of what's going on emotionally and physically, you can release the wound, therefore you can release the medicine. I live in both worlds. I live in both worlds of medical and hypnosis, and I love what I do. So that's clinical hypnotherapy. He says in Mayo, there's a lot of research, incredible research going on right now. We're just catching up with ourselves because this stuff has been proven a long time ago, but we fought against it. So I'm going to tell you a little bit about what hypnosis is, the history of it, what clinical hypnotherapy is, and how it can be applied. So me, been an RN for 30 years. I'm a certified clinical and transpersonal hypnotherapist. What does that mean? That means that I have a lot of training. I have about 3 to 5. The school that I went to is the only school licensed to the Department of Education, and that is the Institute of Interpersonal Hypnotherapy in Tampa, Florida. And it's a 500-hour training school, and it's the only school licensed through the Department of Education in the state of Florida. So there's a lot of accountability. So I hold my nursing license and I hold my certifications from this registered school, this licensed school in Tampa. And I'm also an instructor, an examiner, and on staff at that school. And I love what I do. I love training people for clinical hypnotherapy and transpersonal so we can really help heal the world. He talked a little bit about my international best-selling book. I love that book. I'm writing my second book about how to let go of worry. If any of you worry, you know that everyone says, give me a copy of that ASAP. And then I also do a lot of speaking. I'm an NLP, Neuro-Linguistic Programming Trainer, if you don't know this, and EFT, which is tapping. If you don't know about those things, I would suggest that you look that up. Take notes if you want. I'll give you little hints through the day about how to help yourself, how to help people you know, and move forward. So what is hypnosis? I'll tell you what it isn't. It isn't mind control. I'm not going to make you cluck like a chicken, right? It is a natural state of being. Hypnosis is an incredible modality. What I like to say is to open up your subconscious mind, your supercomputer. And when you access your supercomputer, now you can get to all of the amazing changes that you want in your life. It's a natural change in a brainwave. As we're speaking right now in a beta brainwave here, as I'm talking, you're alert, you're concentrating. This is a beta brainwave. When you're stressed, you're having a bad day, you're in traffic, you are in what's called a high beta brainwave. When you're in a high beta brainwave, that's when you're in fight or flight. There's nothing new coming in this beta brainwave or this high beta brainwave. You are just in survival. You are the zebra. And you're running from the lion. Your body doesn't know whether you have a stressful job, you have 3 kids, you're trying to get your accounts together. It doesn't know. You are the zebra. When you're in that state, nothing new is coming in. You are in survival. And the chemistry of that is toxic. I have clients that are in that state for 15, 18 hours a day and then repeat it year after year after year after year. I have clients who had just right now, I'm working with her for 10 years. She had a suicide of a mother. She had a death of a child. She had all of these things going on, a loss of a job, and a personal illness. And she was the zebra for 10 years. And she was just spiraling down. We have to stop being the zebra and move into what's called the alpha or the theta brainwave. This is hypnosis. It's only a change in a brainwave. How many of you ever feel like you've ever been in hypnosis? Just raise your hand for me. Okay, so a lot of you. So I'm going to tell you, every one of you should have raised your hand because every night when you go to sleep, this is a delta brainwave. Every night when you go to sleep, you go through the state of hypnosis. You know when your arms are heavy and your eyes are closed, but you can still hear what's going on around the house? That's hypnosis. Hypnosis and meditation are the same brainwave, except hypnosis is meditation with a goal. We're working on stuff. We have access to that supercomputer, and we're working on things. And then sleep. So what I tell people is when you go to sleep, you're accessible. You have access to your subconscious mind in that alpha and theta brainwave. So when you wake up in the morning and you know your arms are heavy and you don't want to open your eyes, I tell everyone, I want you to pre-program for your day. You can absolutely begin your day being in charge of the subconscious mind. Because if you're the zebra for all day, every day, you are in the passenger seat. You are in autopilot. And I try to get everyone, when you're in the driver's seat, it changes everything. So before you even open your eyes in the morning, see how you want your day to go. I want you to insert how you want to feel about, if you're trying to eat healthy, how you want to feel about food, how you want to feel about the meeting that's coming up. Because when you're doing that, you're accessing the subconscious mind. That's where change happens. You cannot positive think when you are in a high stress level. There's something here called, this is the diagram of the mind. So you have thought, the conscious mind here is reasons and judges, analyzes and criticizes. This, from research in neuroplasticity, from universities like Harvard and Yale and Stanford, they understand that the subconscious mind is about 5% of what you manage. Right here is called the critical factor. It's like the wall. So you have the 5% of the conscious mind here, and then you have a wall that shows up right around 11 or 12 years old. And underneath all of that is your subconscious mind, which is your memories, your emotions, creativity, beliefs, facts, and fantasy. So a thought comes in to here, it's either accepted or it's rejected based on your beliefs and your past experiences in your childhood and your life. Everything that we experience is filtered through our beliefs about ourselves and the world. And it changes, it distorts everything. So if you're in a high stress level and this critical factor's here, and you're trying yourself, I'm okay, it's okay, I'm gonna be safe, blah, 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 I'm fantastic, I'm wonderful, I can do this. If you're doing it against this critical factor, you're throwing water balloons against a brick wall. It is not happening. You must learn to lower this wall just a little bit. We do it all the time. You do it with breaths. If we breathe in and exhale, you're lowering this just enough so your subconscious mind can hear you. It's very important to speak to the subconscious mind. That's where change happens. So hypnosis is an exceptional, high-focus state attention where one gains direct access to automatic, autonomic, subconscious things. Hypnosis does not put you to sleep, it wakes you up. When my clients have access to that supercomputer, their subconscious mind, now they know what their truth is. Get to the heart of it means get to the subconscious mind. When you get to the subconscious mind, now you're making real changes in your life. It's a state that allows you to access everything that automatically, your inner workings, your decision making, your judgment, your healing within the brain, your immune hormone system, everything is regulated, and there's so much research that it proves that. That is the basis of clinical hypnotherapy. So let's just talk a little bit about the history of, so you know where it came from. It just didn't show up in the last 10 years. It's been around since the 1800s by Franz Mesmer in Germany. And he started doing, he was an MD, and he started doing what he coined as animal hypnotism. And animal magnetism, excuse me. And he started putting people in trance, usually women, and they had incredible results. And the physician started saying, what's going on here? What's happening here? Because he was getting results that was uncommon in this time period. So he got a lot of attention, and not all of it good, because when you're doing something that no one is and they don't understand it, what happens? It gets attacked, right? So he kind of was put in bad faith around that, and he stopped doing it. Then in about 1843, James Braid coined the term hypnosis, which is from the Greek god hypnos, and it means god of sleep, because people thought they would go in a sleep-like state. But now we know it's much different. They're really in a high alert state, and they believed in this magnetism, and they believed in Mesmer. And when they believed in Mesmer, then they believed in the change. Because, and I'll show you later, something called neuroplasticity. When you believe it, and you know that it's gonna happen, it happens. There's such a connection now. The research in neuroplasticity and epigenetics, that when we believe it, it changes the chemistry, and we start creating that in our body. So how effective is hypnosis, right? Why am I standing in front of you? Why do I spend my entire life, my career, talking about it, writing about it, and seeing private clients? Because this comparative study from the American Health Magazine, psychoanalysis, which is just dealing with the 5% of the conscious mind, right? Remember, if you heard people say, I've been in therapy for years? You know why they have to be in therapy for years? Because they're all up in the 5%. They're telling their stories, and you know people who tell their stories. That you can stop them and interrupt them. 3 minutes later, you're talking about something, and they start right where they stopped. They know their stories, and they go it. And if it goes there, it's hitting this critical factor, and it's very hard to make change. It's like a drip, drip, drip in the subconscious mind. 38%, 600 sessions. Behavioral therapy, 72% recovery after 22 sessions, which is a little bit, behavioral therapists get you down into the heart of it. And hypnotherapy, 93% recovery after 6 sessions. Most of my clients see me 3 to 5 sessions, and I would say I specialize in pain, addiction, and anxiety for children and adults. And I see them about 3 to 5 sessions. I see everyone every 2 weeks because I want them to see what changes happen, because it happens very quickly. It can be subtle and it can be very, very quick. So I want them to get that, not associate that with me. But it happens very quickly. Why? Because we're getting to the subconscious mind. You're getting to the automatic, all the chemistry, all the hormones. When you're open to that, you're making change in that altered brainwave. So what is clinical hypnotherapy? Basically, it is just using hypnosis or hypnotherapy for a diagnosed medical or emotional issue. Now, when I do, and you can see the American Psychiatry Association, the AMA, and the APA all say that this is great. It's a great modality. They all have it on their websites. And in the state of Florida, when you have a pain clinic, they have to give a list of alternative care other than pain management, and hypnosis and hypnotherapy is on that list in that thing. So it's all these associations recognize clinical hypnotherapy. That lets you know that this is science-based. This is not woo-woo. I tell people I'm a little woo because I deal with the subconscious mind, but I'm not all woo-woo. I have a very professional office. A clinical hypnotherapist should have a very professional office. You should not go to someone's home to do this. It should be in a clinic-type situation. So, as a nurse, I have a little bit of gray area because I'm a licensed medical professional, but this is the statute for the state of Florida, which basically says that if I'm working with a diagnosed medical or emotional issue, I have to have a referral from someone in the healing arts. Who is the healing arts? It's MDs, it's osteopaths, it's dentists, it's therapists, on and on in that spectrum. So if I have someone who comes to me who's having back pain or migraines or having chronic illness and they want to do a more natural way to manage it, I just have them get a referral from a physician and it's fine. I get a lot of referrals from physicians, from psychiatrists, from pediatricians. I do a lot of natural work with pediatrician children who, my youngest child dealing with anxiety was 6 years old. Our children are anxious. And we have to learn how to manage that. And when a parent, I like to go through the handler, I like to call, which is the parent. Because if the parent's anxious, the children's going to be anxious and they don't know how to manage it. So I like working with both the parent and the child. But I get a lot of referrals, and it helps that I've been a nurse for a long time. I was ER, trauma nurse, ICU, and recovery room, and I loved. So mind-body connection. It used to be the mind-body connection, woo-woo, right? It's very real. It's based in science. If you don't know the work of Dr. Bruce Lipton, and there's a book called The Biology of Belief, I would suggest that if you've not read that, to read that. If you know anyone who's suffering from chronic anything, The Biology of Belief is incredible. And he talks about how our thoughts, our mind, can affect the chemistry in our body to either help us or make us worse. If somebody is getting a diagnosis of cancer, and a physician standing in front of them, and nothing wrong with physicians, I love physicians, never get me wrong about this, but there's a modality for both. If a physician stands in front of someone and says, you're going to die in 6 months, and they take that in, and they believe that they're going to die, guess what happens? They're going to die 6 months to the day. There's a lot of documentation about it. But if someone believes, no, I'm going to do something different, I'm going to live for years, I want to be alive to see how many people do you know who said, I want to stay, my daughter's getting married in 1.5 years, and they told them they would die in three months, and they stay, and they're alive, and they're vibrant. And then after that, they go downhill. It's the biology of belief. That what our thoughts create the chemistry. Epigenetics. If you believe that you're going to get diabetes because your family, you have a genetic disposition for it, and you believe you're going to get diabetes when you're 35, you're already sending all the chemistry, and the receptors and the genes are shifting. This is what we know about epigenetics. Within the nucleus of the cell, you can shift your genes to create or release. It's all documented. There's a lot of research around that. Dr. Joe Dispenza is also really fantastic about this. And there's been reported research around people who have released stage 4 cancer. If you believe it and you're sending that chemistry and you have your will to live is greater than your belief that you're going to die, you will shift your chemistry of your body. It's a well-known fact. So learn to trust your body. Felt sense. Who's ever heard of the word felt sense? Not many people. Felt what? Felt sense is the emotional GPS of your body. It's warning you. So if you are anxious or you're sad or you're worried, where do you feel that in your body? Just think about that. Some people feel it usually between your chin and your hips. This is called the felt sense, feeling the sensation of emotion, energy in motion. When we have a thought, we create chemistry. Basically, all of us as human beings are in a chemical battle, and we have the ability to decide how that chemistry goes. We have a thought that creates chemistry. The chemistry is translated into your body. So if you're angry about something, you have the chemistry of anger. That's what feeling is, right? That's what creates feelings. A thought is just a thought until we add on the chemistry of what's happening in our body. Does that make sense? So now it goes in our body and we get a little tense and we get a little thing, and then we have another thought, yeah, and you did this. And then we have more chemistry and more translation in the body and up and around. And before you know it, you are in what I call a mind melt merry-go-round. And most of us do not know how to stop it. So when we get that little twinge of a thing right here in your chest or in your stomach, we have words in our English language that we've had for a very long time, like gut-wrenching, sick to my stomach, heartbroken. These are translations of the subconscious mind. So something that I do with my clients, and I'm going to teach you guys right now, is something called the release to peace. Is if you're feeling that feeling in your chest, so just close your eyes if you're in here or you're listening on the tape. Just close your eyes for a minute, and as you're doing that, think about something that's bothering you, something that you have to manage through the day. Maybe something that's stressing you out. And feel your body. Just scan your body. Because this is the subconscious mind talking to you. It's always talking to us, but we don't listen. So as you're doing that, put your hand right where you feel that sensation. Good. Take a breath in. Exhale. And as you exhale, tell yourself to relax. Because now you've just lowered that critical factor, that block, and now you're in the subconscious mind. And I want you to, sounds corny, send that sensation love and acceptance. And see what happens. Just send it love and acceptance. And as you do that, it may move, it may get smaller, but you're going to feel it shifting as you practice this more and more. That's you. Now you've just gotten into the driver's seat. Now you've just acknowledged your subconscious mind, and it will release. The subconscious will start with a whisper, and if you're not listening, it gets louder and louder and louder, and if you're not listening to it, then it will create physical issues. It will create other things going on for you. It will get your attention. So it's better. It's like a toddler that's pulling at your leg. If you know a toddler and all you have to do is go, hey, how you doing? And they're like, hi, and then they leave. This is the subconscious mind. We must acknowledge it. So if you start paying attention to the cues, that that GPS, that whoop, alarm going off, if you know that there's something emotional going on, if you acknowledge it, it will release. And if you do that through the day, guess what's going to happen at night? You're going to feel better. You're going to make better decisions. You're going to be better connected to your family. You are in the driver's seat of your subconscious mind, and that always feels better. It always feels more empowering. It feels safer when you can connect to your subconscious mind. This is why I wrote the book, How Big Is Your Butt? B-U-T, because we're not taught how to manage our subconscious mind. We're taught how to push it away and move forward. 60% of my clients, people are always surprised by this, are men between the ages of 45 and 65, people who have a lot of success in their life. I see physicians, I see lawyers, I see businessmen who have many, many multiple million-dollar businesses. They're just not happy, and they're not physically feeling well. But they have everything out here, but we're not in here. We have to live on the inside to make healthy, happy changes for ourselves. So this is the model of which I work, and I'm going to explain it to you in hypnotherapy. We as a society deal with symptoms. Emotionally and physically, we deal with symptoms. Now, the symptoms can be overing, what I call overing. Over drinking, overeating, over shopping, over arguing, right? Overing. It's just your mind's way to try to move you away from pain towards something a little bit more comfortable. So if you at age 15 realize that if you drank alcohol and it made you feel better, guess what now you've done? You've set down this pattern that when I want to feel better and I want to manage, I'm going to have wine, I'm going to have alcohol, I'm going to have beer, I'm going to have vodka, I'm going to, smoke weed, whatever it is. It's just your symptom of trying to feel better. Because on the back end of this is emotions, beliefs. I won't deal with smokers or my addicts or even people with pain unless I will not just treat a symptom. I won't do it. It doesn't work. It'll come back. It's like holding a beach ball down in the water. You can do it, but it takes a lot of effort. You got to let it go and really look at what's going on. It's never about what it's about. It's always underneath. There's layers. And we have to get to the layers for you just to feel comfortable. I love telling people I'm a professional garage door opener. Because all the subconscious stuff that we put in our garage, nobody wants to go in there. It's rattling at night. It's keeping us awake. There's scary things in there. It's dark. We don't want to go in. I help people open the garage door of their mind so they can go in. I don't do the work. All hypnosis is self-hypnosis. I hold the flashlight and I let them go in, and you, my clients, decide what they want to keep, what they want to let go. I'm never in control. They're always in control of what they do. And if there's a block, because I have a big toolbox, I have a lot of training, if a block shows up here, no problem. We'll go around it, we'll go over it, we'll make it smaller, we'll deal with it next time. But we have to get to this model. And above all of this is events and relationships, usually younger than 10 years old. That critical factor is not there when we're younger than 10. Everything was said or done to us is encoded as truth because our conscious and subconscious mind is wide open. We're imprinting. That's how we learn to walk. That's how we learn to talk. That's how we learn to read. We're imprinting automatically, autonomically, subconsciously, we're learning. So if they had a parent who was very critical, they may with the belief that I'm not good enough. Doesn't matter what I do, I'm not good enough. And we carry those beliefs with us for the rest of our lives. Everything is filtering through that. If we had a teacher, I deal with a lot of people who have public speaking, and they want a public speaking. It's very interesting. Some of the people that come in have very serious health and addiction issues, and they clear it, and then they come back in and they're like, hey, I think I want to work on public speaking now, which always makes me laugh because it's great. I want them to see how far they've come that they want to deal with. But public speaking usually goes back to an episode very, very young when they got up or they spoke and they got laughed at or they got sick to their stomach or something like this, and then it's encoded, boom. Right? Imprinted in the subconscious mind, not safe to be present in front of people. So I always encourage people to look at events and relationships younger than 10, and that lead to beliefs, beliefs lead to emotions, and emotions lead to symptoms. If you back that up and you release the cause, then you can release the symptoms. It's very hard to do without doing the rest of this work. So hypnotherapy for medical stats. Breast cancer. Cancers in general, I work with some cancer patients before treatment when they get the diagnosis, during and after. And it's very, very beneficial for them to stay in some of that altered brainwave of that. It's very, very healing for the body. The chemistry of that is incredible. If they live in the stress of the diagnoses, of the family, of the pressures, of the worry, of the projection into the future. What's my family going to be like when I'm not here? If I'm not here, if I'm dying, what's my funeral going to look like? That is very, very heavy chemistry that is not good for the body. They need to spend some time in that altered brainwave of meditation. And if you're not meditating at least 5-10 minutes a day, if you're not taking some quiet time, if you still your body, the mind will follow. You train your body to just be still. If you just sit quiet in your mind and your body for 5 minutes. Your mind will follow, I promise you. And the next time you do it, it will get easier and easier and easier. There are also incredible apps, Headspace app, Insight Timer, Calm, Breathe. These are all great apps that you can try for free. But I want to encourage all of you to spend some time in that altered brainwave, because the price you pay when you do not do that is very, very high, physically and emotionally, and it's stealing from you every day. It steals your ability to focus. When you're stressed out, you are absolutely firing, and your sympathetic nervous system is firing like crazy. And when it's firing, guess what's happening? Anything that is non-essential, like focus or creativity, right? Calm, your prefrontal cortex is diminished, which is your problem solving. When you are the zebra, you don't have to worry about that, so it's very, very hard to focus. So when you go into this altered brainwave, you come down from that. Now the creativity. I work with a lot of artists all over the world that come in from me, and it's so beautiful. I am not artistic, but they found me some way, and they tell each other, because if they've had trauma or drama or death, it's very hard. They can't get in the studio. So when they come and do the work and they clear their heart, then they're creative again. And it's so beautiful to see them just take back their passion of art and love or whatever it is. So spend some time, please, please, just 5 minutes. Give yourself that ability to do that. So placebo effect is very interesting. The placebo effect is, and I think we all know that, is if they're doing a research, sometimes they have to stop research because the placebo outperforms the drug that they're trying to trial, which is very interesting. But we used to believe that hypnosis was all placebo. If you believe it, it changes the chemistry. Now we know it actually changes in PET scans. It changes how you're processing in the brain. Brain scans are showing that it's actually changing how you're functioning in your brain. Very, very powerful stuff. So it's not, it is some placebo, but there actually is science behind it. Now there's something called nocebo. If you believe that you got it, you can't do anything about it, it's negative, that's a nocebo. You're going to create that as well. So migraines, I deal with a lot of migraines. If I do, I'm a relapse prevention specialist, so I have to work with pain with people. I have to work, and I don't even call it pain. If there's someone that you know in your life that has pain and they're always talking about their pain and they're rating their pain, you can just do one little thing, because language is so important in our body and our mind. Just flip it to discomfort. Just flip the word. The word pain is so sharp. It's so hard for the mind, and we grab a hold of things that may not even be related to that word in our mind subconsciously, automatically. So just shifting words from pain to discomfort really helps them. Now, we know that we have pain. Someone can have a pain level of 2 or a 3, especially in migraines. I had a guy who had migraines for 20 years after an injury. And I said to him, he came in, he's like, I really want to get off medication. I've been on these drugs for so long, and it's really affecting my ability to function in my life. And I said, okay, so tell me about what happens when you have a migraine. He goes, well, I go into a room, my family leaves me alone, it's dark, and I watch John Wayne movies. Awesome, fantastic. I said, do this. When you don't have a headache at all, I want you to ask your family for time out, go to the room, shut off the lights, and watch a John Wayne movie. Give yourself permission to do that with a headache. And guess what happened? 50% his migraine shifted. So we have to look at what we're gaining, secondary gains from any kind of pain. And in the comprehensive work that I do as a clinical hypnotherapist, as any clinical hypnotherapist will do, is we look at all aspects, and especially secondary gains. So cancer patients, hypnosis, immune system, it's incredible the research they're doing with the immune system. It changes the chemistry of the body. Wouldn't you rather be in the driver's seat and change this chemistry in a positive way for healing, for joy, to open your heart? And burn patients found hypnosis relieves the pain. So this is incredible. So if you haven't read this book, Norman Dodge, with the brain that changes itself, it's remarkable. It talks a lot about neuroplasticity, and we really are in the minor stages of it, but there's such research that says you can be under control. You can remarkably built-in ability to strengthen and grow the person that you are at any age. At any age. If you believe that you're getting old and your body's going to deteriorate, guess what's going to happen? It's going to deteriorate, right? If you believe because you're born, if you've ever seen these pictures of people without legs or arms and they do these incredible things, if they would have been raised by parents who said, no, you can't do anything, we have to keep you here, they wouldn't have done it. They believed in their ability to do it, and they did it. So you can rewire your brain. Neurons that fire together, wire together. Who's heard of this phrase, right? When do you think that that was coined? 1949. This is how long we've known about this work, but it was pushed aside because they didn't know it, much like Mesmer. But now it's basis of the neuroplasticity that we're doing. How we wire our brain together, fire it, we wire it together. So if someone knows that drinking or someone knows the pain, it creates these very thick neuron connections, and they do that automatically, autonomically. And they have these neural pathways. It's like a well-worn path in the grass between trees that everybody walks. And if you keep going back and forth, it's you know the path, you can see it, and we go back down that automatically. Research shows in neuroplasticity, if you pattern interrupt that again and again, which is what I do, is I teach people techniques to be able to pattern interrupt, to listen to that felt sense, the body, to spend some time in that altered brainwave. When you do that, you can literally change your brain in 3 to 4 weeks. This is the basis of neuroplasticity. It's very real. I see it happen all the time with my clients, make very quick changes. I believe that's why hypnotherapy has such a fast, successful rate, and with addiction as well. Because in addiction, and I'll talk about that in a little bit, addiction is very much about our automatic senses, our urges, our habits go this way, but you can change that in 3 to 4 weeks. So it's easier to do than we think. Whoop. So pain management. Very important in the addiction work that I do. If someone is living in pain, so they have pain and it's a physicality of a 2 or a 3, I can't change disc, I can't change, injuries, shoulders, but what I can do is change the perception of the brain to it. No brain, no pain. Because it goes through gateways, it goes through neurons from the spot. Pain does not happen in the knee. It doesn't happen in the foot or the shoulder. It's a translation through through neurons and gateways to the brain. How awesome is that? Then we know. Because now, if you can interrupt the gateway, if you can change the emotional aspects of that, then you can bring down pain. If someone has a 2 or a 3 of an injury, and then they have worry, and then they have sadness, and they have frustration, and then I feel weak, then it's up from a 2 or 3 to an 8. I help people get from an 8 to a 3, and then they can manage it. And then they can cut their medications down. They can get off the hard stuff and start doing something else, or do yoga again and start creating these, do meditation. This is the basis of a lot of the addiction work that I do, is I help people get to sleep. They have to sleep. We were talking about this earlier. They have to sleep. If you're not sleeping, I'm going to tell you later about how to get a free sleep meditation. There are a lot of sleep apps out there. Please, we must sleep. In order for you to wire and have all the great chemistry that you need, you must be sleeping. You also must be drinking a lot of water. We are dehydrated. There's a lot of research that shows if you just increase your water, that's all the changes that you make, you will have a change in your emotional makeup. It highly affects how we feel emotionally. So if you're feeling a little down, don't go to the doctor yet and get something. Just drink more water for about a week and see how that helps you. So pain, I do a lot of pain. When you change the gates, when I teach people how to dilute pain, discomfort, when I teach people how to disassociate from their body and be somewhere else on a beautiful beach or flying over a glacier, how amazing is that? When they do that, guess what? They disconnect from the neurons, they disconnect. Their brain is somewhere else, no brain, no pain, and they feel less discomfort. And people are so relieved when they do that. We are used to treating the symptom of pain, discomfort, and we give medication for that. We must look at the emotional. People who are only looking at the pain and the symptom of pain are missing a huge opportunity to help their clients make shifts in that and have a life that they want. So what is addiction? Big, long. I want to show you. You can find 10 of these, 10 pages even, of what the diagnosis of addiction. Basically what it is, it's a shortcut to your dopamine receptors so you feel better. a symptom, right? We want to release discomfort and we want to move towards pleasure, and that's when people start with addiction. And as they start with addiction, they start moving to this neuroconnection and this automatic pathway that gets stronger and stronger and stronger, so you have to disconnect them. Neuroplasticity shows if you open up a memory, if you get to cause of addiction, that memory is palatable, malleable, you can shift it within 6 hours. So when I have a client who gets to a memory, and your mind won't take you anywhere you don't want to go, so I never push anybody in a memory, I never insert a memory. But if they go to a memory or a hurt, then we shift it and we change it and we move with forgiveness and understanding, and then we grow up that inner child, because there's 3 ego states: inner child, inner critic, and adult ego. We must deal with these inner child, with our inner critic. We must deal with them. That is our submodalities of our subconscious mind. If you deal with that, then you shift. And I see people shifting a memory like this. It's pretty incredible. And if they keep doing the work of meditation each day, then they can surf an urge, which I call it in my addiction work. They can surf an urge. I do a 4-day program where they're with me about 21 hours, and we're doing hypnosis. And one thing comes up, whoosh, we release it. Another thing comes up, we let it go, we let it go, we let it go. It's just like we're clearing out the garage and we're having a garage sale, and they're throwing away the stuff, and there's a dumpster, and they're getting rid of all of that. When they do that, it's much, much easier to stay sober. Does anyone know what this number means? 13%. 1-3. This is the recovery rate in a really good center that just does regular programming, that just deals with the symptom. 1-3%. And they may, a 30-day in-house program, they may spend $30,000 to $80,000. People who come to me probably been in 2 or 3 of those, so they've spent hundreds and hundreds of thousands of dollars. And it's 1-3. They tell people it's not if you're going to relapse, it's when. So imagine you've just spent $50,000, you've dealt with a symptom, you're feeling pretty good, and they tell you, by the way, you're powerless and you're probably going to relapse, so hey, good luck out there, right? Not good. It's not good. Research shows when you add the cause, when you get to hypnotherapy, which is an incredible modality within the comprehensive program, 60%. It's actually 60 to 75%. I'm running right now about 65%. It's interesting, as I do this work more and more, I get people who are a little bit more difficult and more entrenched in this long term. So if they do have an issue or a relapse, they come in and reboot and they get right back on track. So this is a lot better than that. So what we know is the traditional way is not working. I am a relapse preventionist specialist. I do not detox. I only do behavioral modification. And when you get to memory, I have to tell you, it's very interesting. What they know in research is that the mind is very interesting. 50% of what we remember in our past is based on fact. 50% we make up as the perception of the child. So I tell people, that's awesome. You're already 50% better, because what you were worried about or what you happened didn't even really happen that way. But that's why, as a hypnotherapist, I do not insert memory. It has to come from the perception of the child. And when you change that, when you get to cause, right? If you just deal with the symptom of addiction or pain or illnesses or chronic stuff, you're doing a disservice. We must look to emotions and belief. When someone comes in with a chronic illness, I'll say, okay, so I get their beliefs about it. It makes me feel weak. I'm frustrated. I'm angry. I feel like I'm worthless. I'm not valuable. I'm unloved. I'm alone. And I tell them, how you feel about your illness is usually what caused it in the first place. Because if you're spinning around with I am unlovable and worthless, and you're still creating the abuse that you felt, right? Or how alone you were, if you're spinning in that chemistry year after year after year after year, and you're trying to release it, that causes dis-ease in the body. The chemistry of that. Remember, we're always in a chemical battle, and we can choose what chemistry. The chemistry of negative emotions is highly addicting. That norepinephrine, that epinephrine, all those, that cortisol, it's highly addicting, and they don't last very long. The body grabs a hold of it very quickly. So if you've ever known anyone who is a negative person and they start calming down and life's starting calm, what do? They start stirring that pot. And when they stir that pot, they get that extra surge, because those negative emotions are like, ooh, That's a little bit, especially if you're in chronic pain or you're tired, right? Or you're sad, that little boost of chemistry, it amps you up a little bit and makes you feel a little bit better. But it's very, very toxic for your body. How we feel about our illness or addiction is usually what caused it in the first place. Not that there isn't real physical stuff going on. It's very, very, very real. But if you release the emotions, the beliefs, events from younger, when you stop the echoes from the childhood and you move them forward in a new perspective and new beliefs, it's incredible. It's incredible how people's lives change. Change happens in an altered brainwave. I cannot say that enough. We cannot fight against this, this conscious mind, this critical factor. We must drop that wall a little bit. And you're in it all day long. When you're in the shower, guess when you're in the shower and you've been in there, you thought you've been in there 10 minutes and you've been in there 25, right? Because you're in this altered brainwave. When we're zoning out, when you're driving in a car and you don't know how you got there, you're in that state. So give yourself the opportunity to do that before a meeting, before you go to work, before you get into the house, if there's some stuff going on in the home. Take time to just calm the body. When you calm the body, the mind will follow. Brainwave, again, we must be here. We must be in this programmable state. The answer to addiction is not sobriety. The answer to addiction is connection. People who suffer from addiction must reconnect to new possibilities, to hope, to belief, optimism. They must disconnect from the past, the hurts, the guilt, the shame. They must, if they're going to stay sober and clean and create a new life for themselves. I had a woman I was working in a 4-day program with, and she opened her eyes and she was crying. And I said, "What's going on?" And she said, I hope I could tell the story without crying. It was so emotional. And she said to me, I feel like I'm on a highway with no exit ramps. And now, up there, I see an exit ramp. And that exit ramp is labeled hope. And to have someone feel that and see that for themselves and know that they don't have to stay on this highway of addiction or chronic pain or illness is remarkable. This is why I do what I do. This is why I train people to do what I do, because it's so, so powerful. We must have hope in our life. What we concentrate on, we create. What we concentrate on, we create. So if you're only looking for the negative in your life or the discomfort in your body, that's what you're going to create more of. I tell people to flip it and reverse it. Flip it and reverse it. Just say, hey, I got 4 hours of sleep last night instead of 2. I got up this morning, I'm breathing. Find it, flip it and reverse it, concentrate. The fastest way to fall out of love with people in your life is to concentrate on what you don't like about them. Concentrate on what you love about them. Concentrate on what you love about your life and your body and what's working, and it will start changing the chemistry. Things I know for sure. It's very difficult to stay clean and sober if you believe that you're worthless and unlovable, if you have no off-ramp. This is what I also know. Traditional approach to addiction is not working. 1-3%. We can do better than that for our people. And I love what the government's doing now, but they're just dealing with the symptom and the companies. We're not talking. There isn't a dialogue about how do people release the cause. And that's why I'm so passionate about what I do. I've had a sister, I had a brother, and a nephew die from alcohol and drug abuse. I was raised by an alcoholic mother. I know what it's like to be affected by addiction in all levels. I do not judge. I want to help people find that off-ramp. So it's important, if you know someone who's suffering from addiction, tell them there's a way to move through it. Find a way to do it. It doesn't have to be hypnotherapy, but they have to get to cause. They have to look at what's really going on, and they have to wake up, and they have to be in the driver's seat. There's science behind what's going on. It's so exciting. Epigenetics, neuroplasticity, the power of the mind and the body, right? It's fantastic. And there's a movement now. I believe in the next 10 years that clinical hypnotherapy will be a real modality for people. I already see it in physicians that are referring to me, and they're opening up to the possibility. And this is what I know. I have the best job in the world. I get a front row seat every day to someone getting that moment of, oh, I can do this. I didn't think I could do this. I have hope. And I get to see that change in them every day. And I'm so excited about the possibilities of hypnotherapy. I'm so excited to have shared that with you today. And thank you. So this is my contact information, my phone number if you have any questions. I do on this website, renebrenthypnosis.com. I do free 15-minute consultations. I love talking about all of this stuff. I'd love to meet with anyone who wants to meet and talk about how they can do it. I do a lot of corporate work. I do a lot of lunch and learns for physicians and organizations, mainstream and medical. So if you have any information, book a call with me. PracticeHappyNow.com is my landing page for my book, How Big Is Your Butt? And there's some free meditations there. One is for sleep. So if you know someone who's struggling with sleep, send them. It just takes them into a natural change in a brainwave. And there's another one called Higher Self. Often we hear that inner critic who's beating us up all day long, rah, 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 telling us everything we're doing wrong. Higher self is a way to hear a different voice. We all have a higher perspective. That conflict that we feel within is not a bad thing. It's a good thing because there's a war going on because your higher self, your higher perspective, knows that there's something better for you. And the inner critic is fighting against that. You want to start hearing this voice louder than the inner critic. And so that's Higher Self, practicehappynow.com, and you can get some free meditation. The information's right here. And you can follow me on Rene Brent Hypnosis or Twitter. Thank you so much for your attention.
Well, I imagine that we all learned a lot this morning. And we have time now for 4 brief questions. And, all right, Bob, let's start with you.
Yeah, very interesting. It made me look at things a little bit differently, but clearly, without a doubt, the whole addiction thing is remapping the brain.
Yes.
And you've got to change the neural pathways. Now, we're a medically managed, which is doctor, dual diagnosis, which is therapy. So that part is what everybody does.
Yeah.
But to increase efficiency and to speed up the process of the remapping, we do a lot of integrated services, massage, yoga, hypnotherapy, acupuncture. We try to advance medical equipment and testing equipment. But the purpose of these alternative or integrated services is to increase the efficiency in the timetable. Clearly, if you can't get back into a normal sleep pattern, 100% guaranteed you're going to fail.
Yeah.
That's the number one goal of any addiction program. And then it's to keep them on their med management, because if they slip up, they go right back immediately where they go because those pathways are still hot and still
Yeah, especially the
stimulate.
first 30 days, they're very hot, those pathways.
The number one alternative or integrative services in our facility is hypnotherapy.
Yes.
Without a doubt, by 3 times. It increases our success rate on top of what we do by 15% easily.
Easy.
And it's amazing the things that can be released through hypnotherapy.
Yeah, and I hope that they do follow up with hypnotherapy as well. When they do that, when I do a 4-day with my clients, they're definitely upgrading new genomes within a 4-day, because if you spend that much time in an altered brainwave, and there's layers and layers. So I'm hoping that they're following up with your hypnotherapist, and thank you so much for having a hypnotherapist in your facility. This is amazing and incredible. But follow up with hypnotherapy and continue that work really helps, because it's layer, 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 and sometimes the mind in the first 2 sessions or so won't go there. That's why I really like doing a 4-day intensive, because we're just blowing them out and we're getting to all those layers and really reframing that neural connection. So thank you. Thank you for believing in hypnotherapy and your work with addiction.
Yeah, the way we do it, the hypnotherapist does an individual assessment of each patient, does some pre-programming, and then group is available every week. And the most popular modality we have
for sure.
is hypnotherapy.
Yep.
People come in and they just say, oh, it's time to relax, and it's just an amazing
Yeah,
thing.
it's incredible. Well, people, some of the work's hard. It's really hard. I tell people it's hard, but it's the best thing you're ever going to do for yourself. It's not so easy to connect to the little child within who's been screaming at us for 25 years, right? So, so if you have the opportunity in a quiet time, just connect to your little boy or girl and just let them know that you see them and they're okay and they're worthy. And that's so, so powerful. So thank you for that. Yes?
Hi, good morning.
Hi, good morning.
Toast you some water.
Yeah.
How well received are you by the health insurance carriers and in terms of ability to get reimbursement? Because we work with, the other side of my business is a lot of large corporate clients. And if we can bring something to them that helps them that's not currently really used a lot, that would be phenomenal. Just curious how that works.
Sure. So the insurance, it's they're looking at it, but we're not there. I have mixed feelings about it as a medical professional, taking insurance. I don't take insurance. HSAs will cover for hypnotherapy, so that's good. That's recognized. And a lot of hospitals are starting to hire hypnotherapists, so that's good. But right now they don't accept it. There's not payment for that. But if they get in the mix of it, my concern is I think they need to have a hypnotherapist that manages that, because there's going to be some interruption and some things that are going to interfere with the success of hypnotherapy in my mind. So I'm hoping that when they do come to that state, that we can work together with other hypnotherapists and other organizations that manage that. But that's my hope. I do a lot of corporate work, and they end up, paying me, out of their own pocket, for that. So, yeah, thank you for the question, though. We're hoping. Yeah.
Hi, I'm Elizabeth Wascom. Couple questions. First of all, thank you very much for coming here. When I was telling people about this presentation, I got a lot of skepticism about, what are you going to go to? So as soon as this is up on the website, we'll be sharing this. But also kind of to that effect, so we have, I'm thinking about friends and family who are outside of Florida who wouldn't be able to be treated by you. What do you recommend for people outside of the area, what they should look for in finding and researching or finding someone who could treat them,
Sure.
certification, other schools? Can you just speak to that?
Fantastic question. Yes, so it's very interesting. I do Skype as well, because I have so many. I tell people I see people internationally. That only means I stay up later and have longer hours. But but when you're looking for hypnotherapists not in the area, I would suggest that you ask them about their training. Some people can call themselves a hypnotherapist with 50 to 100 hours of training, which is like 2 long weekends. And it's not hard to learn how to put someone in hypnosis, but it's the protocol that you develop in those extended school. So ask them how long. I would suggest a clinical hypnotherapist has to have at least 300 hours of training to be certified with any organization. So ask about schooling. A lot of hypnotherapy success is based on trust, and someone who comes to me who's pretty straightforward may need someone who's a little fluffy. And then I have someone, Rebecca, in my office who is more, sweet, and she's very light, and I'm a little bit more straightforward. Let's get to it, right? So rapport has to be there. It's very important to build rapport with your hypnotherapist, because if you don't feel safe, you will not go into state. You will not go into a trance. And so it's very important. So look for schooling, ask them their success rate, especially with addiction, and that would be it. And if anyone has any questions about how to pick one, let me know. For physicians, it's very important to give a referral. You ask them if they are a clinical hypnotherapist. They must have 300 hours of training. You do not want to send someone for pain or addiction if they have 50 hours of training. Does that make sense? Yeah. So it's very important. So just ask, it's rapport. Yes?
And as a follow-up, is there any organization?
Just a moment.
Is there an organization like an American organization of clinical hypnotherapists or anything for vetted?
Absolutely, absolutely. I'm involved in 2 of those, which are high standard, which is for 500 hours of training, which is something called ACHE, which is kind of a bad acronym, which is the, now that you're on me, ACHE. I'm not even going to try to remember it. It's in my head. But and also IAIH, which is affiliated with my school. IAIH is in Tampa, and I speak at both of those. I speak at both their international conferences, so those both. And when you sign into my office, I give you my ethics page and the information for those organizations. So if there's any issue with me, that you have the information that you can call, right? Yeah. Yeah.
Hi, Renee.
Hi.
Wanted to share that I am actually a past client of Renee's. And so as a faith-based woman, I was raised in a way to think that hypnotists were like mediums and maybe even witches. It was like, ooh, taboo, you don't do that. And so when I got to know Renee, when I first moved to Orlando, and I saw the quality of the person that she is, and then I saw the science behind it, I went to Renee and I was sharing with her that I love my job. I absolutely love my job, but I was at a point where I felt like the job was running me and I wasn't running the job. And I was trying to figure out how to, physician burnout, right? It happens to us in every discipline. And so I was trying to figure out the best way to lay down barriers and to get free of a little bit of stifling that I felt. So again, Renee didn't give me a single suggestion. All she did was help me relax and tap into myself to find out what those roadblocks were. And I completely changed the way I did everything. I changed my calendar. I went back and talked to my team about how they could better support me. There was no one earth-moving moment where my company had to make a really big change, but by me being able to identify things and really talk through them and let them understand how to help me more and managing my calendar, I block off time that I can rejuvenate myself in the evenings and get more rest and spend time with friends and families, which is now what I recommend to physicians. And I even give myself an hour a week to dream. And that has made a big difference to me because now when I go to meetings and they're looking for ideas and suggestions, I've had that time. I think we forget to dream, right? But I've had that time of reflection and I come with ideas that are usually very well received. And so I feel like I'm doing so much more on much less time, and I'm having a ball doing it. And I really, it was maybe 4 sessions, but it was so freeing, and honestly, I would recommend it. I really enjoyed the experience.
Oh, fantastic, thank you. She said something very important, is that we can't change it unless we're aware of it. We have to gain clarity. In order to gain clarity, you have to tap into the subconscious mind. The supercomputer, it holds everything. So it's only logical, this work is only logical, that if you know the science behind it, that you drop into that state, gain awareness, and then you can make the change. Because your life is a reflection of what's going on internally for you. So dream, just please dream. Yeah.
Morning, Renee. I just wanted to tell you that I spent hundreds of hours in therapy and in counseling. I've read dozens and dozens of books, people like Norman Vincent Peale, Napoleon Hill's Think and Grow Rich, and Zig Ziglar, Pat Morley, all of his books. And every single one of these has to do with your mind and changing the way you think, the way you frame things, the way you receive things. But Renee's book, How Big Is Your Butt, and then spending several sessions with her, I will tell you, had more positive impact and effect on me than everything else I've ever done combined. And I still use those processes of breathing, relaxing, spending time listening to the tapes that we created. So I would tell you that it's really worth your while, and the return on investment is far, far greater than what the expense of doing this, whether you have insurance or not. Thanks, Renee.
Thank you. Yeah. Thank you so much. We have to tap in. So thank you so much. Take time for yourself, believe in yourself, tap into that subconscious mind, and you can make the changes. You can get that off-ramp. Have a great day.
Well, thank you all for coming. I think you'll all agree this has been a very worthwhile time that we've spent here this morning. I want to tell you that as with all of these sessions that we have with more of, the conversation always continues on LinkedIn. We have a group there where if you have questions that you weren't able to get answered or things that occur to you after the meeting, isn't that always the case? You know, you always come up with a really great question when the meeting's over. So if you do, please go to LinkedIn, put that question up there, and Renee will join with us in helping answer those questions. Or indeed, you can go to her own websites. So thank you all once again for coming.